Now, as we move forward from 2020 to 2021, the focus now would be more on vaccination, with number of vaccines getting approval for wide-scale administration and vaccination having started in India recently. I think for the initial part of 2021, the vaccination would be focused on frontline healthcare providers, and then slowly it would trickle down to almost the entire population at large. But other than vaccination, I feel that there is going to be a lot of shift in the way we deliver healthcare as a concept. In case of healthcare, I find that telehealth is going to become very prominent. And that's going to be a way of connecting the patient with the healthcare provider, the doctor. And a lot of the diagnosis would be done online, and even the prescription could be given online. There would be a lot of importance which would be given to devices, especially wearable devices, which would be able to monitor some of the vital parameters of the patients. There would be home use diagnostic kits which would come up, and devices which would come up, which could be connected, and they would be able to upload a lot of their information on the cloud, which could be accessed remotely by the doctors, who would be using that information for directing the healthcare course of the patient. So this is going to be one significant change, the move from the more conventional way of healthcare delivery to a digital way of healthcare delivery. And even within a hospital, we would see that a lot of the equipments which are being used, they would be AI enabled, and they would have access to cloud computing. And so even if a patient is going for an X-ray or a CT or an MRI, these systems would be connected to an AI-enabled PAC system. And a part of the assisted diagnosis would be done by the AI algorithms. We have the first line of vaccines which are being rolled out across the world. But as we know that there are mutations which happen to a virus. And there are already quite a number of known mutants of the original COVID-19 virus. And so these vaccines would keep on evolving. They would have a much wider efficacy. So this vaccine evolution is going to continue. And that's going to be a major focus of the vaccine industry. On similar lines, when we look at the pharmaceutical industry, we would see that there would be a re-emphasis on the development of more modern generation antiviral drugs, and specifically drugs which are able to control COVID-19 infection. So this is the broad prediction for 2021. And we were one of the first organizations to have developed a wide range of products, rather the widest range provided by any organization, whether it is hand sanitizers, PPE, ventilators, COVID-19 test kits, the rapid test kits, as well as the RT-PCR kits, in addition to all the conventional products that we have been working on over the years. Most of our medical imaging, they are getting transformed, and we are incorporating AI algorithms in most of the medical imaging products that we are making. And we're also working on cloud-based computing, which would further augment the type of diagnostic ability of these equipment. So in essence, irrespective of where that particular equipment is involved, as long as it has got some kind of a connectivity to a Wi-Fi network, it should be able to download and upload the files to a cloud server that can be downloaded by a doctor sitting remotely. And there is an algorithm, an AI algorithm, which will be present in these equipment, which should be able to assist the doctor in making a much more precise diagnosis. And that is a standard feature which we are incorporating in most of the medical imaging tools. When it comes to ICU products, we are shifting from the traditional ICU. We are further augmenting them with ICU, which can be used in a home setup, ICU products which can be used in a home setup. The major shift, which is going to have a lot of impact on healthcare delivery in 2021, is moving from the conventional way of healthcare delivery to a combination of an online and offline system. The offline system is what we would expect in a doctor's clinic and in a hospital. And the online system would be all those things which can be done without getting the patient into the hospital. Another thing that might happen is uh, those aspects. Say, for example, hospitals, they have an imaging center, they have an IVD testing center. So those pathological labs, those imaging centers would kind of segregate themselves from the hospital so that their operations could be independent of the running of the other part of the hospital. Because one of the things that we have seen is all those hospitals which got converted into COVID centers, they had seen a significant decline in the number of patients who were coming in into the imaging centers, the number of patients who were coming in for the normal pathological tests. And just because of the fear that if that hospital is treating COVID, so to prevent that psychological impact of COVID, they would probably consider segregating them into a separate section of the hospital. It may not be in a separate building, but a separate section of the hospital, which is segregated from the mainstream healthcare delivery setup.